Today. We're going to start about 2 minutes as there's a few people that are just logging on today. So you should be able to hear my voice pretty clearly. You should also be able to see a PowerPoint on your screen in front of you that says the M2T-Blade. Now, if this is your first time doing a webinar with us, there's two different functions that we can do. On your right-hand side, there's a chat screen. On the bottom of your the PowerPoint, you'll see three different categories where it says questions, polls, and offers. Now, if you have a question, don't post it in the chat area because usually our moderators like myself will miss the actual chat. So with your questions, post them in the question section so we can get to them throughout the webinar and as we're going today as well. So we are going to be recording this, so you can listen to it once we are done this. We still have a few more people just logging in here. I know I got kicked off myself trying to enter in the webinar. So today we're going to spend the next about half hour, 40 minutes together working on canine instrument-assisted soft tissue mobilization. If you're unfamiliar with our company and what we do and how we operate, we're going to talk about a little bit about instrument-assisted soft tissue mobilization to begin this webinar, then how we can really focus on using it with small and large dogs. So again, this is a great new format. Not a lot of people are talking about or working with animals right now besides massage and chiro, and we really believe that this product is great for working with small dogs and large dogs alike. Now, this webinar is also partnered with Doggisage. I'm a dog massage therapist named Will down in California. He's the one that helps write all our content and our information here today. So we kind of taken our background of instrument-assisted soft tissue mobilization, using this course and treating this course in 50 countries around the world, combined with his expertise and his knowledge working with animals. Doggisage and Will specifically work with animals. That's what he does each and every single day. So his profession, his background, his expertise is working with small and large dogs alike, helping them move better, feel better. That's what we're all about, is having them move better and feel better. Now, one thing I really like about Will's stuff too is that he works with in dog shelters every week, working with shelter dogs as part of the rehab process and helping them feel better, which I think is a really cool thing to do. One of my first dogs was in my adult life, one of my first dogs was a Hurricane Katrina survival dog. We went down and rescued her and brought her up and trained her and did all that cool stuff. Unfortunately, she's not around with us anymore. I still have two dogs, Lewis, who's getting a little bit older now, and we do a lot of these techniques on Lewis. And if you look at a lot of our videos online, you'll see that Lewis is kind of the body of what's going on. And we have a little dog, a Pomeranian, named Skipper as well, who also gets treated on a fairly every other day basis, and he is a Pomeranian. So a little bit of the background. I'm going to start with the M2T-Blade first, and we'll work into our actual techniques working with dogs. So M2Tblade.com, we're the original all-in-one tool with instrument-assisted soft tissue mobilization. Right now, we currently work with practitioners such as chiropractors, fitness trainers, massage therapists, all around the world. Just last week, we were in Amman, Jordan, in the Middle East, just next to Israel. We launched our first course in Jordan last week. The week before that, we were in Singapore and Malaysia, then we were in the Philippines. Upcoming, we have courses in Ottawa, Toronto, Hamilton, and Burlington, then down in the south from where I am in Florida. So we developed the M2T-Blade. The M2T-Blade stands for Myofascial Mobility Tool. So our whole goal is to create mobility within the myofascial system. We also developed Vigor Connect tape, which is a custom tape where our practitioners can put their logo on the tape. We're running a really cool special for 5 rolls of custom tape. It's about 110 Canadian dollars, which includes the free shipping. So you can put your own logo on that tape for your own marketing, your branding, and creating your own billboard. Our company right now is based in Hamilton, Ontario, about an hour outside of Toronto. We also have an office just outside of Pompano Beach, Florida, and Manila, the Philippines. We develop courses on proper utilization of the M2T corrective mobility exercise selection and integration into practice. One of the new products that we just launched is the massage gun. This is one that is really cool. It's on special for about $3.99 Canadian, free shipping anywhere in the world. We've made a few changes to this massage gun. We created one more speed. I'm actually right now testing this out on my dog Lewis at the very low speed. He's a half Boston Terrier, half Chocolate Lab, so he has major hip issues right now. Especially, I just live on the beach up here in Canada, and every day he's out on the beach running up and down. And he's kind of moving a little bit slower in the mornings as he's sore. So combined with our instrument-assisted soft tissue mobilization, we'll use the massage gun at a low percussion speed just to help open up his hips and move everything so he can kind of run and play and do the stuff in the summer. As if you're from Canada or in the North States, you know we had one of the most brutal winter times. So now Lewis does not like the snow. But now that it's 30 Celsius out, he wants to be outside every day on the beach. And we just want to help him kind of do that and not be in pain and limp around once he's done being on the beach. So one of our goals is I don't want to talk too much about our products. My goal with this webinar is that everybody can take this information and apply it to your pets, your dogs, or your clients' dogs right away. So we're going to give you enough information in this webinar to actually take it and develop a treatment plan for your small and large animals. So another thing that we do as well is the frozen shoulder specialty course. We don't want to talk about too much about this. We'll do a webinar next week or the week after about frozen shoulder. It's kind of a couple techniques that we put together and that we developed to assess and treat frozen shoulder. Now, frozen shoulder is becoming more common, especially throughout India and Southeast Asia, just pretty much based on genetics and diet. We mostly see this in females as well. And we created a cool little 1, 2, 3 step punch on how to treat frozen shoulder and how to assess it. The whole goal of frozen shoulder is to prevent it from getting worse and prevent it from getting stiff. So combining the tool with specific exercise, we can help prevent that, and we can help create a better quality of life. Now here's a picture of our small dog instrument-assisted soft tissue mobilization tool. Now if you go down besides where it says questions, you can get an offer as well. We have both the small tool and the large tool. The small tool is about 2 inches smaller than a regular M2T-Blade, and it's on for about $149 Canadian. We're also be rolling out a course starting August 15th. That is a full 4 module course. It runs about 8 hours. It is the assessment, treatment, and rehabilitation of the small and large animals. This today is just going to be about an introduction to create some awareness and some education based on working with animals. So what you will gain from this webinar today. So what we're going to our goals of teaching. So first is the foundation of instrument-assisted soft tissue mobilization. Even if you've done our webinar before, you probably have heard this information in the past, but we want to make sure that everybody understands the foundation of IASTM. We're going to spend about 5 to 10 minutes just on the history, the theory, and the application of working with tools. We kind of assume that everybody's newer to this webinar, so we still need to introduce these concepts to make sure that everybody's on the same page. So when we go into our canine work, we can all be on the same page of what's going on. Once we go into our foundations and we teach about the theory and application, we'll move into the introduction of Canine IASTM. How to assess, contraindications, indications, treatment programs, and strokes. So we're going to teach you all that kind of stuff with our webinar today. Then we'll go to our theory of application. So we're actually going to give you a step program of how to treat and assess a dog. So once you listen to this webinar, you can take this application and apply it to your pets or your clients right away to help them move better and feel better. So a little bit about instrument-assisted soft tissue mobilization. This is just our general foundations of IASTM. Again, if you've taken our webinar before, we have talked about this in the past, so it's not anything new, but we want to make sure that everybody has the same information, the same concept of what's going on. So instrument-assisted soft tissue mobilization is a new form of treatment of the fascia and the connective tissue. A newly developed tool allows a therapist an extremely efficient way to locate functional disorders of the connective tissue and to treat. So our tool does 2 things. It's going to be an assessment tool and a treatment tool. We can use this tool to assess and find out where those myofascial adhesions are. We can also use it to treat those myofascial adhesions as well. So instrument-assisted soft tissue mobilization is carried out with an ergonomically designed tool called the blade. With the aid of fascial restrictions can be detected and treated. It allows the rapid localization and treatment of fibrosis, chronic inflammation, and degeneration. The ergonomic design of the blade allows the therapist to track down adhesions in the fascia and to treat them with reasonable pressure and thrust technique. Now, when we go through this presentation, we do describe the differences of a human and a dog. We don't want to always use the same principles and application as we would on your patients compared to your dog. So, a little bit more about fascia and soft tissue. So the fascia system has been termed by Grotz in 1938 as the functional joint because it provides structure, strength, extensibility, and flexibility all in one. It weaves itself through muscles, ligaments, and joints, but all of that, the head, nerves, brain, and organs. So what we're searching for is myofascial adhesions. In the human body, tissue is supposed to slide and glide over one on top of another. When we use our instruments, we want to find out exactly where those tissues are adhered, create mobility and movement between those tissues using our tool in active range of motion. So with the fascia, it is a connective tissue within the body. Think of your entire body wrapped in fishnet hose, both internally and externally, including each individual bone, nerve, and muscle. Over time, fishnet hose gets entangled or require adjustment. If not, you'll develop an impingement. Fascia will work in the same manner. Once the fascia becomes entangled, impingement may occur. It may impinge blood circulation, muscle, or movement. So again, when we use our instrument stuff, our whole goal is to improve mobility, improve blood circulation, improve muscle movement. When I injure a tissue or I become hurt, our natural reaction is to not move very well, which is going to cause more pain. It's going to cause more issues down the road. When it comes to dogs as well, when their muscles become fatigued or they have issues, they have arthritis, we'll especially see this in hips with hip dysplasia, we want to create movement. We want to create more blood in the area, what's going to help with tissue healing and taking pressure off the nerves. So here's a picture of a myofascial adhesion. This is a cross-section between the IT band and the vastus lateralis. When I'm walking and running in everyday life, the IT band slides and glides back and forth over top of the vastus lateralis. When I have pain, there's going to be adhesions that stuck that prevents that movement, which is going to have decreased blood flow and more irritation to the nerve. We want to improve that mobility so we can take pressure off the surrounding joints. So if we have myofascial adhesions, tight muscles, with our webinar today, we are going to fix this condition with instrument-assisted soft tissue mobilization. So when a tissue is damaged, it will heal in a disorganized pattern, forming adhesions and scar tissue. These adhesions lead to limitations in range of motion and increase in pain. So we always tell our clients, nerves don't like two things. They don't like compression and they don't like stretch. If I have a nerve that's compressed or a nerve that's stretched, it's going to cause pain, irritation, and being uncomfortable. We're going to use these tools to aid in our ability to detect these adhesions as well as treat them. We're going to use these tools to restore the quality of this functional soft tissue. This is achieved by introducing microtrauma to the tissues, increasing inflammation, and speeding up repair within the body. So how it actually works, how we're going to use this product to improve mobility and improve the blood flow in the area. So scar tissue and adhesions prevent the fluid movement of muscle, tendon, ligament, and fascia. As our M2T-Blade instrument glides over the adhered tissues, the stainless steel tool will reverberate the feeling in our hands. Like a stethoscope amplifies the sound of a heart, our tools such as the M2T-Blade series assist us in finding exact areas of restriction. When it comes with animals as well, we'll still do a screening stroke to find exactly where they're tight, where they have that scar tissue, where they have those adhesions, so we can help prevent them and create that better mobility. We can do this with large dogs and small dogs alike, and that's why with our smaller dog tool, we created it to kind of fit a small dog a little bit better versus our large dog tool for our larger dogs. So my one dog is about 40 pounds, a little bit chubby, half Boston Terrier, half Chocolate Lab. I'll use the larger tool on him. My other dog, which is a Pomeranian, will use the smaller dog tool on him because, again, it doesn't fit around the hip and around the stomach very well like it would with the bigger dog. So if you already don't have the M2T-Blade, whether it's a small one or large one, this is kind of the breakdown of how it works. So we're the only company that has a double bevel with both a superficial and deep treatment edge. There's 8 treatment points to affect all areas of the body. So again, there's only one tool that we use that's going to work on all dogs. Again, one of the reasons why we love this is that you don't need multiple tools to work with a dog. If you buy one tool, you only need one tool. You don't need to buy a whole collection or set that's going to set you back $2,000 or $3,000. One tool can work on every muscle and joint in your canine friend's body. There's an integrated handle for increased control and outcomes. Can be used in either left or right hand. It's stainless steel made in Canada. So we use what's called a surgical grade stainless steel. So it's a 0.316 stainless steel. The same stainless steel that is in the surgical room that a stethoscope or a scalpel is made out of. Meaning for cleaning, you only need to wipe it clean. It's a non-porous stainless steel, so it doesn't hold on dirt or debris, and you don't transfer from one person to another or one dog to another. One of my favorite slides is that this is actually outdated now because we just taught the course in Amman, Jordan. So we're in 50 countries worldwide. I think Jordan brought us up to 51. When this graphic was made, we we're only about 30. Now we're in 51. Also, there's Singapore on here and Malaysia. That doesn't show. The China as well. So one of the things that we take a lot of pride in is that we're one of the largest growing tools across the world. If you're on our Instagram, you can see we just had another practitioner from Korea just post about using the blade in Seoul, South Korea as well, which is really cool that we're going to help so many people worldwide. And with this new canine product, we want to do the same thing. We want to help as 1 million dogs worldwide move better and feel better. So just a little bit about the tool. So the major difference between the large tool and the small tool, so this is the large tool pictured right now, is that it has one less hole on the right side. So we cut about 2 to 3 inches off that small tool just so it can fit small dogs very well. Now you see from the top to bottom, we have 1 and 2. Those are how we assess different kind of tissues. Now moving counterclockwise, you'll see 3, 4, 5, 6, 7, and 8. Those are all the tools, or those are all one tool combined into one tool. So we can use every single edge to work on different muscles and joints of the body without switching through multiple tools. When we get to the canine portion of this presentation, we'll show you a couple of hand grips to use as well. So you can optimize each tool or each point in the tool to get the most out of your treatment with your animal. So how we use it to detect faulty tissues. So once the area of interest has been narrowed down by assessment, the entity is used to find specific areas of restriction. We're going to start by using a sweeping motion over the adhered tissues, which will give us a tactile feedback felt through the tool into the practitioner's hands. Once areas of interest have been identified, treatment with the M2T can proceed. So if you're working with a dog, we'll talk a little bit about this later on. We'll work in the area that we think it's going on. So we'll go through our canine assessment, a little bit of movement, palpation, then work on that area that we find restrictions and work specifically on where those top bands are, trigger points are, and myofascial adhesions. How are we going to treat with the M2T-Blade? So tissues are always treated from superficial to deep. We don't want to go right into a deep hip muscle without working on the superficial muscles first. And this goes along with any kind of human or dog. The M2T must always be held at a 45-degree angle to the targeted tissues. The M2T can be push or pull, but should only be used in one direction at a time. Only moderate pressure through the tool is needed to affect the tissues. If severe reddening of the patient's skin develop, it is usually a sign to move on to the next area of interest. So let's go. I didn't want to go through that so fast, but I wanted to really get into our canine stuff. So we talked a little bit about how the M2T-Blade works, how it's structured, and our principles of treating. Now let's focus directly on working with animals, or our canine instrument-assisted soft tissue mobilization. So first of all, our indications. Because animals can't talk to us, we need to be very clear on what the indications are for instrument-assisted soft tissue mobilization. First is relaxation. So helping a dog, large or small, feel better. Increase oxygenation of the blood. So again, if a dog, like we talked about in our previous slides, if a dog is not moving very well, we have less blood flow to the area, which is going to impede healing. Pain relief. Now again, with my dog, Lewis, you can tell that he's in pain, he's lethargic, his hips hurt. Some days he can't walk up the stairs. Some days he can't jump on the bed. He can't get on the couch. Right now, he's sitting beside me as I present this webinar, and I had to lift him to get on the couch. Now, we'll probably give him a nice little treatment before we go out to the beach this afternoon. So again, you can just tell that he's in pain by the way he's walking. He's not doing his everyday activities. Improve flexibility, improve the immune system, reduce age-related issues, reduce arthritis and hip dysplasia discomfort, muscle tension, soreness, weakness, and spasm relief. So we don't want to treat your dog like you would treat another person. That will most likely be too rough for them and cause adverse effects. Instead, you want to use gentle motions with the M2T blade to make sure she or he is comfortable. Here are some steps that you can get started on giving her relaxation treatment to reduce pain and improve range of motion. Now, if you watch a lot of YouTube videos, you'll see that instrument-assisted soft tissue mobilization can be very uncomfortable, and you can see in the patient's face they're not always having a good time, and they can be in a little bit of pain and agony. With this tool, our goal is not to create discomfort. Our goal is to create mobility. If you take our Foundations to Instrument-Assisted Soft Tissue Mobilization course, like in Jordan, Singapore, or Toronto, our whole goal is to create mobility. It's not to create pain, it's not to create bruising, it's not to create petechia, it's to create relaxation, comfort, and mobility. And when it comes to canines, we want to achieve the same thing. Our goal is to improve mobility and improve the lifestyle and lifespan of our animals. So the first steps is to make sure that your dog is calm, submissive state before you begin the IASTM treatment. If your dog is, we'll say, has anxiety, is agitated, it's not the greatest time to start with rubbing a metal tool across the dog. While one of the goals is relaxation for your dog, starting when she's anxious or fearful may reinforce the mental state instead. So a couple steps to just help them calm down and relax. Try going for a walk. Start your treatment by petting your dog gently all over. While you begin your treatment, talk softly to your dog and keep him calm and relaxed. Start with massaging your dog's neck with your hands, not with the tool, by making circular motions. Remember to keep pressure gentle so she is comfy. Once your dog is calm, you can move on to treatment with the instrument to the problem areas. So our first step is make sure the dog is calm and relaxed. Like we said in these points, if your dog is anxious, fearful, or has a lot of energy, you're going to reinforce those movements as well. Again, we are using an instrument here, so they may get a little bit fearful of what's going on in their skin. When they're calm and submissive and relaxed, you get a better treatment as well, and the muscles will be calm around the area. So let's dive deeper into canine anatomy so we can be safe and effective with our treatments. So here's a quick picture. We're going to be referring back to this picture on areas to avoid and areas to treat as well. So dog skeleton anatomy, speaking of skeletons, this dog has 320 bones in her body and around 700 muscles. Muscles attached to bones via tendons. Depending on the breed of dog, they have different types of muscle fibers. So again, when we do our course, we're going to break it up again. This is more of an introduction. We're not going to go too deep into the different kind of muscle fibers with dogs. But again, if you take our certification course, we talk about treating a golden retriever versus training a Pomeranian like my dog Skipper. In order to picture below, you can find the direction of the major muscles. So muscle direction. Apart from the side of the neck, your initial scanning strokes will be performed lengthways along the direction of the muscle fibers. Strokes on the side of the neck will follow the direction of the back of the dog as though you're petting the dog in a one long stroke. So like we talked about before, we want to start with a scanning motion. So step one is going to make sure the dog is calm and relaxed. Step two is you want to scan the actual area. This is not a treatment. This is to find what's going on and where those myofascial adhesions and those muscle tightnesses are occurring. So we're going to scan the area in the direction of the dog as you were petting the dog in one long stroke. So these can be very general, very long base strokes. So here's another picture of just the superficial muscles, the way we're going to follow it. So if you see from the side of the neck, it goes straight down into the shoulder, all the way down to the paw. Once I go to the ribs and mid-thorax area, we're going to follow along that muscle as well. All the way once they hit the hip, we'll go straight down towards the paw as well. So how fast we're going to follow these strokes. So use a slow, steady, and sweeping stroke to scan for adhesions or restrictions. These areas will be found by tactile feedback through the tool. Once the problem has been spot located, increase the speed of the stroke, but shorten the distance covered. So when I do my stroke, finding exactly where those myofascial adhesions are, We're going to go slow and very gentle and very broad. Once I find that tactile feedback in the same direction I find that tactile feedback, I'm going to pinpoint the area and go a little bit faster to break up those adhesions and to bring blood flow into the area. I don't want to treat the entire area in the same stroke. If there's nothing wrong with those tissues, unless you're doing a straight relaxation versus rehabilitation, we're going to slow it down right into the area and strengthen up the speed to help break up those adhesions. Per area, when you're working with a dog, should be about 30 to 40 seconds, or until you feel like there's blood flow increasing to the area and that tactile feedback is less and less. With a human, you'll start to see redness and petechiae come to the area. When we teach our course, our goal is not to create that redness and that petechiae in the area. With dogs, we're not able to see that redness and that petechia come in. So we need to be a little bit more in tune of what's going on. So we always want to say 30 to 40 seconds per treatment area, slow, fast on the exact area you feel those myofascial adhesions. How to hold the M2T blade for canine use. So again, always have one hand in contact with your canine. We developed this tool so there's always one hand on. If there's one hand on your pet, it's going to create more comfort and more relaxation for the dog. Even when it comes to humans, we always want to have one hand in contact with the skin, one hand in contact with your patient. When it comes to dog as well, like we talked about, we can't physically see the petechiae and the redness coming to the area. So we need to palpate as we're going over top of the area. It's going to really calm that nervous system down. You can feel and palpate those myofascial adhesions decrease as well. Now, with our tool in humans, we usually apply a cream or a lotion. We typically recommend cocoa butter. When it comes to animals, there's no need to apply a cream or a lotion as we're going over top of hair, and we still get that slide and glide over the tissues. The poundage of pressure, so with a canine, we suggest 2 to 3 pounds of pressure is required. When it comes to a human, we recommend 6 to 8. Dogs have a lot less fat and a lot less dense tissue, so we don't need to apply the same amount of force. We just need to use a lot less force just to engage the muscle and engage that soft tissue and open it up. Now, how we're going to hold it. So here we're going to show you 3 ways to hold the actual tool when we're treating our pets. So with these images, we're actually showing it with our original M2T blade. When it comes to our smaller one as well, it's the exact same grip. It's just going to be about where you can see in this image, you can see his fingers over top of the second hole. That's how long the small tool is. So you can still have one hand on the tool. So with our tomahawk grip, this is the grip we're going to use to sweep the areas. Like we talked about, we want to first walk the dog, relax him, calm him down, massage his neck, massage the areas to really create that relaxation mode. Then we want to sweep the areas. We're going to use our tomahawk grip to actually sweep and find where those myofascial adhesions are. This is also going to be really good for large breeds when we're treating specific areas as well. The next stroke I'm going to use is my reverse concave grip. Great for working on the intrinsic muscles on large dogs and large areas on small dogs. So again, once we've done our sweeping area, we scan the area with our tomahawk grip. We'll go into a reverse concave grip. You can see the very bottom of that hook. We call that point number 3. With our point number 3, we can really focus on the areas. I personally like doing this around the hips. So my dog has those arthritic tight hips. I'll use a reverse concave grip, focusing on that number 3 to open up areas around the hip. From there, we're going to our single hand concave edge. Great for working with intrinsic muscles in large dogs and small dogs, the focal point of treatment. So with my single hand concave edge, you can see the very bottom point, that's our point number 7. And the far right point, that's our point number 8. If we have trigger points or really tight adhesions, I can take point number 7 or point number 8, apply a little bit of pressure in the area, just to help alleviate those tight top bands and those trigger points across the areas. In our single concave edge, over push grip, when more control is needed to provide relief. Typically with this one, it's a little more of aggressive hold, and we won't really suggest using this on small dogs. We'll typically use it on larger, thick dogs. German Shepherds, Golden Retrievers, Mastiffs, just if they have really thick, dense tissues, I want to get through those thick thigh muscles, we'll use this. We can also use this for fanning around the treatment around the bony areas, such as the hip. Treatment type. So we just looked at how to hold the tool with our treatments. We have the 3 treatment. Now our treatment type. So general treatment, this is a basic treatment routine you can do anytime to maintain flexibility, good health, and prevent injuries. The strokes will be fairly light and shouldn't cause any discomfort. And we also have our specific treatment. So this treatment is that you'll be doing a target specific condition or area. Each specific area or condition should have 3 to 4 days rest from the M2T blade between treatments. Other modalities such as ice, heat, red light, and stretching can be performed daily in between blade treatments. So both treatment types, so whether you're doing just a general relaxation or specific rehab, will begin with a mild warmer such as a walk if not painful. If walking is painful, a heating pad or bag may be applied. Running or playing is not recommended prior to treatment because it puts the dog in an excited state and will take a while for them to settle down for the treatment. This should be followed by a light massage. This will also help prepare the dog for areas you're touching, such as helping them locate tight or painful areas, such as your assessment. You'll then use the M2T blade with various strokes to locate and treat the areas. The next session will cover the basic strokes and their usage. So, typical areas to avoid is in yellow. So again, you will be able to get this PowerPoint and everything as well. If you do purchase our small tool or our large tool or a certification program, you do get a book that has this all outlined as well. So the areas in yellow are the areas to avoid when you're treating. These are typically tight, bony areas that are painful. We want to specifically stay on the soft tissue areas of the butt dog. General treatment plan. So again, you can take this plan and work with your dog right away if you have a tool. So make sure you've done some sort of warm-up, such as a walk or like the massage that we talked about previously. Once the dog is in a calm state, introduce the blade to the dog by letting him see it, smell it, and possibly take a lick. My dog has been around this tool for about 6 or 7 years. I still show him each and every time the tool, just so it's not a surprise or a shock going up against his skin. Have the dog lie down. Once the dog is lying down on his or her side, begin petting the dog slowly, calming with just your hand. This is also when you'll be feeling the bony parts to avoid, just like those spots we used in that yellow diagram a couple slides prior. Do this for about 1 minute until they're fully relaxed, and use the M2T blade in a scanning stroke with edge 1 or 2 in the same motion you were petting. So like we talked about our first hold, we're going to be using treatment edge number 1 or 2 to scan the area once we find those areas to treat. Make sure to keep the tool at a 45-degree angle to the area you're treating. The first 3 or 4 strokes should be light, about as much pressure as you use to pet. Like we talked about, the actual poundage for this will be about 2 to 3 pounds. After a few strokes, you can increase the pressure to locate adhesions or restrictions. You'll only spend 30 to 60 seconds scanning each area. If no problems are found, refer to the following picture for areas to avoid with the M2T blade. General treatment plan continued. So work through the different muscle groups, starting from the neck and working back. Move along the back behind the strollers, working with the latissimus muscles. Next, move the deltoids and triceps of the upper foreleg and work downward towards the feet. You'll notice muscles are very thin in this area, so gentle pressure is only applied here. You then continue on the chest and ribs using appropriate pressure depending on how much muscle and fat is covering the ribs. If your dog is very thin over the ribs, it's better to skip this area than to cause any discomfort. The next area to scan is the back, just in front of the hips. Avoid any bony areas like we showed in our diagram prior. Then move on to the next of the glutes, legs, and lower leg. Here again, the muscle is very thin and pressure will need to be reduced to very light strokes and to avoid any discomfort. Always make sure to match the treatment edge of the M2T blade with the contour of the body part you're working with. The entire treatment should only take 10 to 15 minutes to complete if no adhesions or restrictions are found. So specific treatment conditions. Again, in this webinar, we're only going to talk about 3 specific treatments. Again, in our course, we actually talk about a lot more than these 3. So the first one is going to be the ACL strains or tears. This morning alone, I saw 2 of my friends that had their animals have an ACL sprain or injury. Just because it's the summertime, they're more active, they're doing a lot more running, and they're a little more careless as well. So this is a very common condition that we see. So no, if you suspect an ACL tear or strain, consult your veterinarian immediately for diagnosis and recommended treatment. Once One symptom of damaged ACL is a dog will stand in a tiptoed stance on the damaged leg while standing still. Interesting, the dog will usually be able to run and play even with a completely torn ACL. Just like humans, we see this as well. You can still play, just there's a lot of lack of stability within the knee. To treat a damaged ACL, you focus on the muscles in the yellow area. It's important to avoid the bony areas. Also treat both sides of the dog, since they'll compensate with the other leg. Remember to match the edge of the M2T blade with the contour of the area you're treating. You'll begin with a quick scan and move the sweeping stroke across the large, thin muscles. Brushing or strumming and framing strokes will be used on the muscles behind the knee. It's important to treat above and below the knee in order to help supporting tissues. You'll be using edge 4 or 6 of the M2T blade on the tendons and muscles in front of the ankle. So like we talked about here, here's the areas focused on the ACL strain. You want to focus on both sides. So if it's injured on the right, you also want to focus on the left. We're also going to focus on the muscles above and below for those compensation patterns. You'll also want to really focus on what type of strokes you want to do. If it's an acute injury, you want to do slow strokes to help with the relaxation because those muscles will be in spasm, trying to protect the joints. If they're farther along in the rehab process, you want the muscles to be facilitated and work better. You can do short, fast strokes to help stimulate those muscles around the knee to help with the rehabilitation and the strengthening process. Next, arthritis of the knee. Arthritis of the knee is common in many dog breeds and is treated with the same treatment as the ACL issues. So again, we're not going to treat the direct joints of the knee. We're going to work on all the compensatory muscles above and below the joint and working on both sides as well. Just remember, if they are arthritis on the right side, we need to treat the left as well. On the left, you may need to do some slower strokes just to relax those muscles because they may be overworking and overcompensating and take pressure off the opposite leg. Next is going to be hip dysplasia. Hip dysplasia is an unfortunate common in many breeds. The good news is the proper treatment of the M2T can help ease pain and restore flexibility and strength. See the picture below for the areas that are treating for hip dysplasia. So we need to work on the front and the back. We also need to work on all those muscles across the thoracic spine and across the lumbar spine of the dog as well. So the reason we'll be treating the shoulders and the front of the legs as well as the hips is because when a dog has hip dysplasia, they tend to walk blocky or with more weight shifted to the front legs. This adds unusual strain to the front legs and can cause problems with the shoulders or elbows over time. Begin with a quick scan over the area using edge 1 or 2 of the M2T blade, then move sweeping stroke and brushing strokes. Making sure to avoid the pelvic bones and the high end, avoiding the scapular bones in the shoulder area. The point of the hip is very sensitive and should be worked carefully and gently. So that's our entire presentation. I know we took about 40 minutes, 45 minutes to go through that. There's a lot of information. We will be sending you a replay of this as well. Like that, but this is just an introduction. We want to make sure that you guys get some information to help kind of spark your curiosity of helping dogs move better. As this technique is not just for humans, or we're seeing a lot more in horses, it's also for our pets as well. Now, if you look on the offers, you can get the small tool for $149 and large tool with $199. We're also starting a course August 15th. We're allowing 20 people to register. It's a live online course that myself and William, who's a dog massage therapist, is going to really teach you through how to assess, treat, and rehab dogs from all conditions. This is a certification course. If you want to learn more about that, email us at education@m2tblade.com. If you do have any questions, always email us at support@m2tblade.com. We're always here to help you guys, give you guys the proper information, and help you learn more about these tools and this process. Again, thank you for joining us this afternoon. We hope to hear more from you guys, and we hope to hear back later. Thank you.